I am Professor Mandisa Kakaza. I am the head of Department of Neurology at Steve Biko Academic Hospital. Can you lift for us that right arm? Okay. And now can you lift for us the left arm? Yeah, so that's still a little bit difficult, but it is getting there. It's getting better. The important thing is that people need to be aware of strokes, how they present, how they get treated, and how they can also be prevented. Can you lift for us the right leg? Can you lift for us this left leg? Okay, so it is getting much better. So when we look at causes of a stroke, the commonest that we see is commonly strokes increase with an increase in the age, okay? And one of the things that we often notice is that it will be patients who have diabetes mellitus, patients who have hypertension. Those two conditions are often associated with a stroke. Can you tell us when you came in, how did you feel? How was how was your arm and leg working? Yeah. So you could hardly move them at all. Yes. And how did it happen?
I got up and I wanted to speak to my wife and I had slurred speech.
And then?
And then she said, you must go to the doctor.
Okay.
And I went to a private doctor and he said my blood pressure is sky high.
Okay.
So he said, I'll monitor you.
Yes.
As I was sitting and waiting for monitoring me, I felt my arm becoming numb.
Yes.
My leg becoming
numb. Yes.
Then he said, no, we must rush you
to hospital. Yeah. So the symptoms that people often present with, we often talk about the acronym FAST, which is drooping of the face commonly, and weakness of the arm, that they can't lift the arm. Okay, and we often talk about the patient having speech problems like a slurred speech or inability to talk. And the main thing is that when that happens, they must immediately present to their nearest stroke unit or hospital so that they can be assessed for a stroke. So one of the things we look for when we examine stroke patients is to look for what we call upper motor neuron signs. And one of those signs is looking at the deep tendon reflexes. For instance, this is one of those things that is often done even when someone goes to a general practitioner, that you just hit the tendon and you can see that the leg starts moving. And when you looking at the, just relax, Baba, and you can see that the leg that has got weakness often is has got quite a brisk movement. Okay, so that is how we look for deep tendon reflexes, to just check if there is asymmetry between the two sides. When the patient presents with a stroke, which is the one where the vessel has clotted or has been blocked, then we do something called thrombolysis. Okay, and we can only do that within a stipulated period of time. So normally we would say within 4.5 hours. But at Steve Biko Academic Hospital, we have software, which is rapid software, that actually allows us to then assess the patient and give the treatment up to 9 hours after the onset of a stroke. But that can only happen because of the software. Under normal circumstances, if only a normal CT scan is done, then that treatment can only be given within 4.5 hours. So patients who feel that face drooping, slurring of the speech, inability to lift up the arm, often associated with weakness of the leg on the same side, they must quickly go to their nearest hospital. Main thing that is always worrying with stroke patients is that when they start to experience the deficit, the neurological deficit, they always think it's going to get better on its own. And that has to stop. That has to stop. They must immediately come to the hospital. And of course, there's always beliefs as well. Someone might be having weakness of the leg and then they will say maybe they stepped on something. or they walked over something. And those are the things that we need to now realize, that as soon as you feel that weakness of the leg, please come to the hospital.